we will get started this morning. We have Dr. Elliott here, who is from University of Michigan, from the Public Health School and from the Institute for Social Research. We also often refer to it as SRC, though those are two different things. And Dr. Elliott was responsible for the population-based sampling scheme that we follow in March and responsible for picking the clinics that you all recruited. And so he's going to talk a little bit more today about that process and why it is so important. And I will just let you all take it away now then.
All right, thank you very much, Alexa. Okay, so so that's me. They've asked me to talk today a little bit about the importance of random samples in medical research. So I've got a few slides here, and we can also have time for some questions and discussion at the end. Okay, so why are we working so hard to get a random sample of pregnant women in Michigan, right? I mean, we could have maybe picked some clinics where everybody would be really joyful to work with us and everything would be a lot smoother. But whereas we're working in some clinics where there's, it's a little trickier and there are some, very different groups of women we're working with and so forth. So the reason for this is that we've tried to come up with a random sample. The technical term is probability sample. And it's going to allow us to make accurate estimates of say how common illnesses are in a population, or how certain behaviors are associated with certain diseases. So in a way that if we were working just in a more convenient sample of clinics, we might not be able to make those estimates with the same degree of accuracy or with the same sort of ability to assess how accurate these estimates are. So there are, many other reasons. One of the issues, of course, is also dividing up limited healthcare resources and other factors as well that we can do with this random sample. And I think one of the things that's at least it keeps me sort of interested in this area is the fascinating fact that it takes a surprisingly small sample to get an accurate estimate of a population. So I just have a little pretend example I'm going to go through here. This is statistics. I'll show some numbers, not too much math, but I think you're all comfortable with that kind of stuff, given what you're doing. So so if we have let's say we have a high school stadium with 1,000 people, and we want to know what fractions support the home team. So one possibility is we could pick 100 at random, ask them, and then use this fraction to estimate how many support the home team in the stadium. So so I'm going to do what's called a simulation here. I'm just taking it, basically pretending to pick 100 people from a stadium over and over again. And if we try that 100 times, and there are actually 700 home team fans in the stadium, say 70% of the stadium supports the home team, the actual fraction we get out of that sample of 100 shows on this table. So so most of the time we won't get exactly 70%, but we very often come quite close, right? So most of the time we're within a few percentage points of the true 70% number. And as a matter of fact, we never get more than 10% away in these across these 100 different little sort of simulations, if you will, these sort of repeated samples. So the other thing that that is kind of implicit here, we actually can figure out mathematically. We have a way of determining how accurate this estimate is. So we actually can say that about 95% of the time, that will be within a certain percentage point difference of the true value. So so that's just a little example of what goes on when we have a random sample. And again, small, we're just picking 100 people at random out of 1,000. So what can go wrong if we don't have a probability sample? So having a really big sample is not enough to guarantee accuracy. And there's a very old but very famous example from a poll done back in the 1930s about the 1936 presidential election. So it was with a magazine called Literary Digest, no longer published, but was very popular in upper middle class households. And they took lists of their subscribers together with people who had bought automobiles recently and people who had telephones. And of course, this is the 1930s, in the middle of the Great Depression, and really only relatively wealthy people could afford such things, particularly recent car purchases from the early 1930s. So they have essentially a very well-to-do sample. It was big, but it wasn't representative. And they predicted a landslide victory for the Republican. So we've just been through the 2020 poll. We've seen lots of these red and blue. I guess we switched the colors. Yeah, these are right. These are the same colors as sort of used nowadays. So Franklin Roosevelt actually won nearly the entire country. There were only 2 states that voted for Republicans. So so it was a huge landslide, completely the opposite of what they said, and kind of an embarrassment for the Literary Digest, but a good example of why random sampling is important. And another example, a little closer to what we're working on nowadays, and honestly a little more important, was for medical research. And this had to do with studies of seizures caused by fevers, sort of febrile, it's called febrile seizures. And I actually my own daughter had one of these. She had a terrible fever. She was about 2 years old, and probably up way over 105 degrees, although we couldn't get a good measurement at the time. And she was convinced she was actually being attacked by bugs. So we got her into the hospital. They gave her some fever-reducing medications, and she settled down. And it was kind of just a one-time thing. Nothing really happened from it, and she's now all grown up and doing fine. So so there were some early studies of these situations. So this is back in the 1970s, 60s, and 70s, that showed if kids had convulsions from these fevers, they had increased risk of epilepsy, brain damage, and even death. But these studies were conducted in hospitals where children were often sick for other reasons. So I actually had a colleague, this is way back when I was at the University of Pennsylvania, who early in his career, he did a study from it wasn't exactly a fully representative sample, but it was essentially something close to that. It was a random sample from sort of 12 geographically dispersed major medical centers that showed no significant difference between these seizures caused by fever and the control groups in terms of their longer term outcomes. Now, this was particularly important because for years, children who had these fever-reduced seizures often went on long-term doses of phenobarbital, which was a sort of a sleeping pill, also used to calm seizures in epileptic patients. This dosing itself, particularly in children, can cause long-term bad side effects, including brain damage. So effectively, thousands of children suffered unnecessary and permanent harm because of a lack of a representative sampling design in the medical research here, is the bottom line. These kids are being given medications that have potentially severe side effects for no good reason. And the differences, I put the numbers here, but the differences are quite dramatic. Just a tiny, like less than 5% of kids in the representative sample went on to have major problems versus up to 70% in these sort of non-representative samples. So I guess I should say, it's okay if people want to interrupt with questions or just unmute yourself and ask. I'm just kind of zooming along here. We'll have some time at the end too. But, okay. So what is a probability sample? So we want to do this representative sampling. So how do we do it here for our study here in Michigan? Well, we want a well-defined population. So it's basically births in Michigan over a certain time period. And our sampling frame basically is going to be we'd like a way to sort of sample the women who are giving birth in a way so that every one of them has a chance to be sampled, and they have some known chance. It doesn't necessarily have to be exactly equal, but everybody has to have a chance to be in the study. So our goal here is to get this representative sample of 1,000 pregnancies. The problem, of course, is there's no list of pregnant women from which we can pick. So our solution is to do something that's a close approximation. So while not all women, receive medical care and give birth at hospitals, the vast majority do in Michigan. And so our plan, of course, has been to go to clinics and associate with hospitals and recruit women there. So we randomly picked 10 hospitals and then a couple clinics at each hospital. We haven't exactly, some of the times we've had to go down to one clinic. But generally we've done 2 clinics at each hospital and then 50 women at each clinic. So there's a little bit more mathematical trickery here. So I do have some fractions. This is farther gone of the math. But by picking bigger hospitals with a larger chance, what's called proportional to size sampling, and then sampling the same number of women in a hospital, we end up with every woman having the same chance of being selected. So basically what happens if we had a hospital of 2,000 births per year, and there's approximately 100,000 births per year in Michigan, we sort of give that a 2,000 out of 100,000, or about 1 in 50 chance of being selected. We then are going to be sampling 100 women from that hospital out of the 2,000. That ends up with basically 1 woman in 1,000 being selected. And the hospital that has fewer births, right, has a smaller chance of being selected. But then because they have fewer births and we're getting the same number, a woman, if the hospital is selected, the woman at that hospital has a bigger chance of being selected. These things actually kind of cancel out. So everybody, whether they're at a bigger hospital or a smaller hospital, has the same chance of being selected. And that's kind of the logic that we've used here for our sample design. So how do we know? I mean, we sort of assumed here that, that we know how many births are at a hospital in a given year. And so that's where the sort of the secret sauce comes in here. We're using birth certificates. So all birth certificates in the state include both the location of the birth and the doctor who was attending, if there was one. And it turns out over 98% of Michigan births are at one of 83 birthing hospitals in the Lower Peninsula with an attending physician. So we've used these birth certificates to construct a sampling frame of the hospitals with the number of births per hospital to get our selection of hospitals. And so these are the 10 March hospitals. I've put it next to a map that sort of shows the population density of the state. You probably will know that, majority of people in Michigan live in the southeast area, sort of around Detroit and Ann Arbor. And then we have, some cities up Saginaw and Flint, and then the western part of the state, Grand Rapids and Muskegon. And there's a few little other pockets of towns, and then some very thinly populated areas in the north. So we've picked these 10 hospitals. You can see they kind of closely map the population density. They're not all in the city. We have 2 sort of more rural hospitals, one up in Traverse City, one in Port Huron, which is the one we're still trying to get started in, as well as 2 in Detroit, 2 in the city of Detroit, 2 in the Detroit suburbs, Ann Arbor, and then these other towns as well. So including a hospital in Grand Rapids, which is the largest hospital in terms of births in the entire state. Okay, so what's the bottom line for you as a recruiter? You're the most important person in this process, right? Without being able to successfully recruit, we don't have a study. We're not able to contribute to the knowledge, the scientific knowledge that we're hoping to. So, beyond this, it's if you can successfully recruit as many women as you can that you approach, that as you limit how many women refuse to participate, we can reduce this problem of non-response. So if we go back to our little high school stadium example, we sort of assumed that everyone we picked would talk to us and they tell us, what team they represented. But suppose that, the home team people, oh, they're happy to talk to us. They're home, right? But the away team people are like, I don't really want to, say I represent the visiting team here. So maybe only half those people would talk to us. So we guessed then on the average that 83% of the stadium supported the home team, that, there was more support from the home team than there actually was. It was 70%, right? So that this non-response problem can crop up. And of course, we just went through the 2020 election. If you followed that, you might have, noticed that there were these predictions that Biden would win, particularly in the upper Midwest, quite handily. So he did win Michigan and Wisconsin, but he was the average of the polls suggested he'd win them by about 8%. And he actually won by just under 3% in Michigan and by less than 1% in Wisconsin. And there's definitely been some evidence that Trump voters were less likely to answer calls, web polls. They essentially wouldn't respond. Or if they did answer the phone, they would hang up when they found out it was a political poll than Biden voters. So similarly, if women with certain characteristics are less likely to be recruited, we'll underestimate those characteristics. So that's why it's important that when we do approach a woman, if possible, I know it's not always possible, that we do our best to recruit who actually comes in. So I think that's it. I just wanted to say thank you so much. This has obviously been a crazy year. We've had to work on the face of COVID restrictions and concerns. And I guess we're all hoping that 2021 is going to be better. So